Hey guys, it's Dr. Hansen here. Listen, in stem cell news lately, this guy right here, if you remember him, Powell used to play for us here in San Antonio, recently switched teams, but he was just reported as having getting stem cell therapy done himself for a knee. Again, very, very common, especially when you're very active like this. He had quite a bit of scar tissue built up and didn't want to have surgery, so what do? Stem cell treatment instead. Scar tissue, if you remember, is indicative of damage. Anytime there's damage to an area, that scar tissue lays down, and that's really what immobilizes the area, keeps the nutrients from getting in and out, it keeps the body from having a proper healing inflammatory response, and leads to further degeneration and the need for things, like pain management and surgery. So this is getting to be very, very common. In fact, probably standard practice at this point at that level. I don't know for sure. I don't work with them necessarily, but very cool stuff. Powell getting his knee taken care of using stem cells, and I suspect what we're going to see is these players start living longer, performing better. Injuries, they're bouncing back from it a lot quicker. Their careers extend, and that's them playing basketball. But what about you and I living our normal lives? Just because we don't have a $10 million contract on the line and we're on TV, it doesn't mean we don't have a life to live. It doesn't mean we can't benefit a lot from these sort of regenerative therapies. So it makes perfect sense. I read that and thought, okay, well, yep, totally understandable. But a lot of people just aren't aware, again, that this stuff is happening so regularly, especially at a high level. But anyways, very cool. So I look forward to see how he turns out with it, but I suspect at this point he's going to be able to keep playing, do really great, and respond very well to the treatment. All right, guys, that's stem cells today.